afternoon, everyone, and welcome back to the Brainy Boomer Lecture Series. We're so very happy that you've all joined us today. We would like to begin by acknowledging that the McGill University Research Center for Studies in Aging is located and our work is done on unceded Indigenous lands. The Kanien'kehá:ka Nation is recognized as the custodians of the lands and waters on which we gather today. Tiohtià:ke, commonly known as Montreal, is historically known as a gathering place for many Indigenous peoples. Today, it is home to a diverse population of Indigenous and other peoples. We respect the continued connection with the past, present, and future in our ongoing relationships with Indigenous and other peoples we serve within the Montreal community. In 2007, the McGill University Research Center for Studies in Aging, or the MCSH Education Committee, started the Brainy Boomer Lecture Series in order to suggest practical steps to both improve and maintain brain health, as well as to promote healthy lifestyle choices amongst the most populous generation in history. The MCSH Education Committee, which was founded in 1996, has three main objectives: identifying education needs of healthcare providers, seniors, caregivers, and the public, and to develop responses to meet some of their needs; to enhance the positive image of the aging process by addressing stereotypes and myths about aging; and finally, the dissemination of research on aging. Our guest today is Dr. Simon Wing, who was born and raised in Montreal. He went to medical school at McGill University and did his residency in internal medicine and fellowship in endocrinology and metabolism. His postdoctoral research training was at Harvard Medical School in Boston and at the National Research Council Biotechnology Research Institute in Montreal. He is an endocrinologist at the MUHC, a professor of medicine at McGill University, a senior scientist and leader of the Metabolic Disorders and Complications Research Program at the Research Institute of the MUHC. Before continuing, we would like to remind you to please mute yourself on Zoom, and that if you have any questions, you can either write them down in the chat box on Zoom, or you can wait until the end of the conference to ask them. And now I'd like to invite Dr. Wing to start a presentation.
Great, thank you so much, Caitlin, for the invitation and also the introduction. It's my pleasure to give this talk on the relationship between diabetes, dementia, and I'll try to keep it practical and at the end talk about what practical measures can be done with respect to this relationship between diabetes and dementia. So in terms of the presentation, this is the outline. I'm going to begin with talking a bit about the diabetes epidemic, which is going on worldwide, along with the COVID pandemic, as well as the dementia epidemic that is going on worldwide. And then in order to kind of situate how diabetes can affect dementia, I'm going to just briefly talk about what diabetes is, and then from there move into how diabetes and dementia is it can synergize in order to make, unfortunately, cognition worse. So I refer to it as like double trouble. And then finally, at the end, what are the measures that we can take to minimize this kind of adverse connection between diabetes and dementia. So begin with the epidemic of diabetes. So this is a global map that kind of shows you the prevalence, or the percentage of the population that has diabetes, or the number of people with diabetes throughout the world. And it may be hard to see these little numbers, but basically they're numbers that at the bottom here start with the number of people with diabetes as of last year, and then the projections for the number of people who have diabetes in 2030 and then 2045. And so you don't need to look at the individual numbers, but I think focus on how much diabetes will increase over the coming 20 odd years. And you can see that particularly in places like Africa, it is expected that there'll be more than a doubling of the number of people with diabetes by 2045. And similarly, in the Middle East, North Africa, we will see almost a doubling. as well as a very significant increase in Southeast Asia, which includes here India and Pakistan. And in North America and the Caribbean, we'll expect to see a more modest increase of about 25% of the numbers. But in terms of another way of looking at it is that as of last year, from data collected by the International Diabetes Federation, 1 in 10 people in the world have diabetes. And that's true in Canada also. And it's what makes this even worse is that half the people who have diabetes don't actually know that they have it. And then another almost 1 in 10 people will have what we call pre-diabetes or borderline diabetes. So their blood sugar is not high enough to be for them to be officially diagnosed as having diabetes, but their blood sugar is already above the normal range. And then most of these people with diabetes live in low and middle income countries, which have fewer resources for both management and the prevention of diabetes. So that poses a significant problem going forward. And this is a significant economic problem in that about 12% of all the money that we spend in the world on healthcare is spent on diabetes and its related issues. So we talked about diabetes being an epidemic. Well, I think many of you listening in today also recognize very well that dementia is also becoming a global epidemic. By comparison, today there are about 55 million people in the world with dementia, so significantly less than the 537 million people with diabetes. But what's striking is that the number of people with dementia is expected to almost triple by 2050. As I said before, half the people with diabetes don't actually know that they have diabetes. And with dementia, at this time, 75% are undiagnosed. So the number of people is probably much larger than the 55 million that is estimated to be suffering from dementia today. And as with diabetes, many of these people live in low and middle income countries, and so certainly have significant challenges with care and managing this problem. And in a huge amount of money, even though we only estimate that 55 million people in the world have dementia, 1.3 trillion dollars or $1,300 billion in terms of healthcare expenditures are spent on dealing with this problem, and actually exceeds slightly the almost $1 trillion that are spent on managing diabetes throughout the world. So what are the drivers? Why do we have these two epidemics? Well, the epidemic in diabetes is driven by an epidemic of obesity in the world. So this is what we call a heat map, and this is best shown in the United States. So the maps are more readily available for the United States than in Canada. But in 1990, the number of people, the percentage of the population with obesity in the United States was mostly less than 15%. So the blue means very low and the red means very high. So most states in the United States had prevalences of diabetes of under 10% or 10 to 14%. But 25 years later, in 2017, you can see this has changed dramatically. So here, low is green, and there's almost only 2 states that have diabetes where less than 20% of the population have diabetes, whereas almost the whole of the country fit into that category in 1990. And then you have these frightening states, mostly in the South and the Midwest of the United States, where over a third of the population is known to have diabetes in 2017. And thankfully, those numbers sorry, this is obesity. I apologize. I'm talking about obesity. Thankfully, though, the number of people with obesity seems to have plateaued in the last few years, and so it has not continued to rise, which is very important, since it is the main risk factor for diabetes, and it is what is driving the epidemic of obesity, the epidemic of diabetes in the world. Now, what are the drivers of the epidemic of dementia? The biggest one, of course, is aging. So with the improvement in living conditions throughout the world, and with the better treatments available for many chronic diseases, people are living much longer lives. And so this is now exposing them to aging in the brain and in the nervous system. And so this is currently the biggest risk factor for dementia. The other risk factors for dementia are the presence of other chronic diseases, such as diabetes, which we'll be focusing on today, high blood pressure, high cholesterol, heart disease, as well as kidney diseases. But as I mentioned, today we're going to be focusing mostly on the link between diabetes and dementia. So just to make sure we're all on the same page, I'm going to spend a couple of slides talking about what is diabetes. So diabetes is a disorder of metabolism, and the feature of this disorder that's most well known is that patients with diabetes have increased levels of blood glucose, which is a type of sugar. And so normally the body keeps the blood sugar level or blood glucose level very constant, somewhere between 4 and 6 millimoles per liter. But it is also worth bearing in mind that diabetes is not just a disorder of sugar, but it's also a disorder of protein metabolism as well as fat metabolism. So not only are blood glucose levels elevated in blood, but also amino acid levels as well as fatty acid levels are also elevated in the blood of patients with diabetes. Now, how is it that the body normally can keep the blood sugar so well controlled, despite the fact that sometimes we're eating and so there's a lot of sugar coming into the blood, and other times we're fasting and we're not eating? For example, it's very common for people not to eat for 10 to 12 hours overnight, and yet the body keeps the blood sugar completely in this normal range, even when we're not eating. And so the ability of the body to keep the blood sugar so well controlled is due to the presence of a sensor in the body that is measuring blood glucose constantly. And this sensor of blood glucose is found in our pancreas. So for example, after we eat a meal, the meal gets digested in the stomach and the intestine. And from the intestinal tract, the digested food is then absorbed into the blood. And so the glucose comes into the blood after a meal. And once the glucose starts going into the blood and raising the blood glucose level, the pancreas senses this and will secrete insulin. And the insulin will go into the bloodstream and then has the effect of pushing the glucose out of the blood into cells of our tissues. And the main tissues that will take up glucose after a meal in response to insulin are our muscles and our fat tissue. So just to summarize again, so when the blood sugar goes up, the pancreas detects it and secretes insulin into the bloodstream, which then acts on skeletal muscle and fat to get those tissues to take up the glucose out of the blood and bring the blood sugar level back to normal. So at this point, I just need to tell you that there are two main types of diabetes, and we just call them type 1 and type 2. Type 1 diabetes used to be called juvenile diabetes because it occurs mostly in children and young people, and it's due to destruction of the cells in the pancreas that make insulin. So for some reason in type 1 diabetes, the body thinks that the cells that make insulin are foreign objects, and so they go and destroy them. And so because these patients with type 1 diabetes don't make any insulin, they need to be treated with insulin in order to live. But type 1 diabetes represents only about 10% of the total population of people with diabetes. 90% of people with diabetes have what we call type 2 diabetes. And in type 2 diabetes, patients still make insulin, but the insulin is not able to work as effectively as normal because the tissues, particularly the skeletal muscle and the fat, do not respond as well to the insulin. They're what we refer to as they're resistant to the insulin. Insulin is made, but when it stimulates the muscle and the fat, the muscle and fat don't take up as much glucose as they should. And so therefore the blood glucose levels remain elevated. And so most of what I'm going to be talking about today in terms of relationship with diabetes and dementia focuses on type 2 diabetes, partly because it does represent 90% of the people with diabetes. So why is it bad to have diabetes? I mean, if it was just because the level of sugar in the blood is a bit higher than normal, would anybody really care? But it is important. It is not good to have diabetes because diabetes is more than just a problem having elevated blood sugar. It appears that the elevated blood sugar, as well as the other elevation of other metabolites like amino acids or fat tissues, all of these can increase your risk of heart attacks, of stroke, of kidney disease, of blindness, foot ulcerations, as well as neurodegenerative diseases such as Parkinson's disease and Alzheimer's disease, which is why I'm here speaking with you today. So, what is this link between diabetes and dementia? Why is it a double trouble sort of problem? And the reason it is because it's now pretty well established that diabetes can increase your chances of developing dementia. And so people with diabetes have a 2.5-fold increased risk of developing vascular dementia, which is the type of dementia that comes from blockages in blood vessels, both large as well as small blood vessels in the brain. And it also causes a 1.5 to 2-fold increase in your chances of developing Alzheimer's disease. And so it's for this reason that we're now very interested in trying to understand why is it that diabetes increases your risk of developing dementia, whether it's vascular dementia or Alzheimer's disease, to try to understand how we might prevent it. And so we're now recognizing that dementia is a complication like diabetes, just like stroke or blindness or heart diseases or kidney diseases. But we've only become aware of it over the last, 10 years or so because of the fact that people with diabetes are living much longer than they used to. So, so how can we tackle or address this double trouble of diabetes predisposing to dementia, and also when you do have dementia or early cognitive impairment, if you have diabetes, the disease tends to progress more rapidly. So how can we try to deal with this problem? Of course, the simplest approach, most logical approach, is if diabetes increases your risk for it, is try to prevent diabetes. And so how can we prevent the development of diabetes? Well, as I mentioned before, the biggest risk factor for type 2 diabetes is obesity. And so it's obesity that is driving to a large extent to this increase or epidemic of type 2 diabetes, which then leads to complications of diabetes, including dementia. So the best approach would be to try to prevent obesity in order to prevent the downstream complication of diabetes. So how can we prevent obesity? Well, of course, what we want to do is to achieve a good body weight, a normal body weight. And a normal body weight is obtained by having a proper balance between the calories that are going into the body, which mainly is due to the amount of food we eat, and the calories that are being burned by the body, which is usually due to physical activity, as well as our main metabolic rate of metabolism in the body. So, well, what's a normal body weight? How do we know if we have a good body weight? Well, there are two ways of kind of estimating this. One is this kind of simple rule of thumb, which is that if you're a man, for the first 5 feet, we'll give you 106 pounds, and then we'll add 6 pounds for every inch of height above 5 feet. So, for example, if a man is 5'10", then his roughly ideal body weight should be 106 pounds plus 60, or 166 pounds. For women, we give 100 pounds as an estimate for the first 5 feet, and then add 5 pounds for each inch afterwards. So if a woman is 5'5" tall, then her ideal body weight would be somewhere around 100 pounds plus 25 pounds, or 125 pounds. And depending on the type of body frame you have, whether you have a small bony frame or a large bony frame, that healthy range body weight can be plus or minus 10% of this so-called ideal body weight. The more scientific way of estimating the ideal body weight is to use what we call a body mass index, or BMI measurement, which is calculated by taking your weight in kilograms and dividing it by your height in meters squared. And so when you do that, a normal body weight would be would give you a body mass index of between 20 and 25. So how do we achieve an ideal body weight if we're a little bit overweight? And so, as I said, it's a balance between the amount of calories we eat, take in, as well as the calories we burn, which is largely through physical activity. And so if what we eat is much greater than the calories we burn by physical activity or burned by our just resting energy metabolic rate, then we'll gain weight and become obese. On the other hand, if we're burning many more calories than we're ingesting, either through physical activity or through an increase in our metabolic rate, then we'll lose weight. So first, let's talk about the food intake, the calories in. And I think we all know that controlling food intake is very difficult, particularly in Western societies. But this is also now becoming very true in other parts of the world. And I think there are many reasons for this, but one of the key ones is that our bodies were evolved throughout history it was much more likely that we would have famine than that we would have excess food available. So our bodies have evolved over time to develop all sorts of mechanisms in order to withstand famine rather than to withstand overabundance. And so our bodies are always made to store food as effectively as possible and to store it as fat. And another reason is that we're recognizing that food can actually be an addiction. And so I think many people have the experience that they'd like to lose weight, but they find it very difficult to control appetite. And so it's really, not just an issue of wanting to do it, but our brains can sometimes be wired in a way to make food almost behave like an addiction. And then one of the key reasons that obesity has become so much more prominent in the last 20 years is that compared to the amount of money that we are earning now, food has become cheaper and cheaper. In other words, the percentage of our money that we spend on food has been getting smaller. And so that in this way, because it's been cheaper, the food has now become much more available. And so if it's available and we have difficulty controlling our food intake, and then to have our bodies, which are designed to store all the excess energy from eating more food, it's very easy to understand how we can become overweight or obese. And so a recent study actually done here at McGill by some researchers at the Montreal Neurological Institute, as well as those in our metabolic disorders program here at the MUHC, has shown that for patients who are overweight or obese who went on a diet, those who were able to lose weight activated certain areas of the brain that are involved in control. And so it's like our bodies are naturally made to want to eat more and store more, and the only way to override it is by activating centers in our brain that are in regions that are made for decision making, and to be able to try to restrain what would actually be our normal natural impulses. But practically, what are some practical skills that we can use for trying to maintain a healthy body weight? Obviously, if you need to lose weight, the best thing to do is to speak to a dietitian who can provide professional advice. But if you're waiting to see a dietitian, we'll think about things that you can do in the meantime. Here's just a rule of thumb. which is that on your plate should be a balanced meal that includes a portion of protein, a portion of vegetable, and a portion of starch, carbohydrate starch, meaning bread, potatoes, rice, or pasta. And as a rough idea, I'll give you a rough idea of how much you should put on that plate. You can just use your fist as an estimate. So there should be about a fistful size of protein and a vegetable and a starch or carbohydrate on your plate. And then in addition to protein, having this balance of protein, vegetables, and carbohydrate on your plate, it's good to have 3 fruits a day, distribute throughout the day, 2 servings of dairy products such as milk or yogurt or cheese, and if you're milk or dairy intolerant, to use fortified soy beverages. And it's best to minimize eating prepared food because prepared food, there are studies now that suggest that food that is already pre-prepared and either frozen or in cans tends to be more what we call obesogenic, more prone to giving you obesity. And of course, in restaurants, food is always made to taste good, and often portion sizes are much larger. And so a good strategy to lose weight is to be preparing most of your own food. Just a few other comments about a healthy diet is to decrease or make sure that you're not eating too much fat or salt. So our normal recommendations for a healthy diet are that we should eat no more than 3 servings of red meat being defined as pork, beef, or lamb per week, so less than 3 times per week. Avoid deep fried foods, which absorb a lot of fat in the food. And when we do use oils, to use healthy oils such as margarine, olive oil, or vegetable oil instead of butter or lard. Eggs, best to keep that down to about 3 or less per week, even though this is not as important as we did think it before. And then to help maintain good blood pressure, it's best to minimize the amount of salt that we add to food or salt-like additions such as soy sauce, and to minimize it in the cooking. So those are just some kind of practical tips about how to help put the amount of food that we eat in the proper amount in this balance between the calories that we bring in, the calories that we burn. So what about burning calories? What can we do about physical activity? Now, some people, I see patients, most of my patients in my clinic have diabetes, and some of my patients have this misconception that that as long as if we're doing a lot of physical activity, it doesn't matter how much food we eat, we'll just burn it. But in actual fact, one needs to do both, because physical activity alone will not be sufficient to typically achieve weight loss if we are overweight. Whereas it is possible to lose weight by eating less without changing physical activity, but it's unlikely that one can lose weight just by increasing physical activity alone. And the reason for this is that one has to do a lot of exercise in order to burn calories. And so, as an example, just think about this yourself. This question: how much exercise do you think it takes to burn off a slice of cheesecake, which has about 250 calories? Does it take 15 minutes, 30 minutes, 45 minutes, or 60 minutes of walking? And the answer is that it takes 45 minutes of walking in order to burn off a slice of cheesecake. So that's why the best way to lose weight is to combine both a good diet as well as physical activity. And physical activity doesn't necessarily have to mean, doing, unusual exercise or really high intensity exercise in a gym or special equipment. It can be as simple as walking. And as you start to walk, you can walk slowly at a slow pace, but over time, you can build up your walking to more higher level. How much walking should one do? Well, the kind of current recommendations you've probably heard about is that we encourage people to do at least 10,000 steps a day, which roughly estimates about 45 to 60 minutes of extra walking a day besides the walking that you do just in your routine activities. And the best way to track this is with a step counter, which now is found in every smartphone. Every smartphone has a built-in activity counter. So as long as you're carrying your smartphone with you, it's actually counting the number of steps that you walk in a day. And then, of course, there are these Fitbit type devices, which you can wear that counts your steps. And then there were these actual pedometers, which were the original step counters, which very few people use now because of the fact that Fitbits and smartphones are so routinely available. Now, probably most people in our society are on the sedentary side at this time, so they probably don't do 10,000 steps a day. So a very practical way is just first measure how many steps a day you're walking. And let's say if you're only walking 3,000 steps a day, then increasing gradually. So aim to, as a target, to increase the number of steps you walk a day by 500 steps every month. So in month 1, go up to 3,500. In month 2, go up to 4,000 steps a day, and very gradually get to, you'll be able to get to 10,000 steps in typically in less than a year. Now, so those are the ways to try to prevent diabetes. But of course, as I mentioned earlier, half the people with diabetes don't actually know they have diabetes. And so it's important to recognize that we should be screened occasionally to make sure that we don't have diabetes. Of course, that can be screened with a very simple blood test by your family doctor. And so who should be screened for diabetes? Everyone over the age of 40 should be screened for diabetes every year or two. If you have a relative with type 2 diabetes, then you should be screened before the age of 40. And then every couple of years after that, if it's normal. And if you're a member of a high-risk population for diabetes, and this would include Asians, Africans, Latinos, and our indigenous people. And also if you have a history, if somebody has told you, a doctor has told you before that you have borderline blood sugar, or if you develop diabetes during pregnancy, or have given birth to a very large baby, then you should also be screened even before the age of 40. And if you have obesity or any other diseases that are associated with diabetes, you should be checked. And also if you're on medications that can increase your blood sugar, such as some psychiatric medications or medications for HIV, or if you have sleep apnea, that's also been associated with diabetes. So the best solution for dealing with this double trouble of diabetes and dementia, of course, is not to get diabetes. But if you do have diabetes, is there still something that we can do about it? And the good news is, yes, there is. And so this is a study that was just published last year from a large a cohort of people in the United Kingdom who are followed over a large number of years. I think the study's been going on for 10 to 20 years now, where they have identified that amongst those people in the cohort who have diabetes, that if you can avoid other problems, then that can decrease your chance of developing dementia. So, for example, if you have these factors include having good blood sugar control, and we measure blood sugar control by measuring the amount of sugar that's bound to a protein in red blood cells called hemoglobin. And so, if your hemoglobin with glucose on it, called hemoglobin A1C, is less than 7%, then that's considered good blood sugar control. So, if you have good blood sugar control, good control of blood pressure, if your body weight is good, if you don't smoke, and if you don't have any protein in your urine, if you do physical activity, such as we talked about before, of 150 minutes a week, which you would achieve by, let's say, doing at least 10,000 steps a day, and if you have a good diet, that all these factors can decrease your chance of developing dementia, even if you have diabetes. So if you don't have any of these factors, or less than 2 of these factors, then your chance of developing dementia compared to somebody who doesn't have diabetes is about 2.5-fold. But if you have more of these good factors, such as not smoking, having your blood sugar in control, as you increase the number of these elements that you have, then your chance of developing dementia goes down to the point where once you have at least 5 out of these factors, then the chance of developing dementia is only slightly increased, maybe even about the same as that of somebody without diabetes. And so controlling these other factors, such as blood pressure, not smoking, keeping a good weight, or doing more exercise, eating well, all of these will decrease your chance of developing dementia. Now, as we said, one of the important elements for preventing development of dementia is to have good blood sugar control. So how do we treat diabetes? As I mentioned earlier, if you have type 1 diabetes, then we need to treat with insulin. But if you have type 2 diabetes, we have many other drugs. Metformin is the most commonly used prescribed drug in the world for diabetes, and it's usually the first drug that's prescribed because it makes the body's insulin work better. As I mentioned before, insulin is type 2 diabetes occurs because the insulin is not as effective. The tissues are what we call resistant to insulin. And so metformin decreases this insulin resistance. And it also helps prevent the liver from making sugar and putting that sugar into the blood. And it's also a good drug because it doesn't have a side effect of causing the blood sugar to go too low. The only problem is that some people will develop some stomach upset, or they don't tolerate the metformin due to causing stomach pain or bloating or gas. Then there are a large number of other drugs that we can use when metformin isn't enough to control blood sugar. And these include our three different classes, which are either in what we call DPP-4 inhibitors, but you would recognize them by their names, such as Januvia, Glyza, or Forxiga. There are these stimulate the pancreas to make more insulin. Then there are drugs such as Jardiance or Invokana, or actually this Forxiga belongs here, which helps lower blood sugar by pushing the sugar out of the blood into the urine. And then there are drugs that can help people lose weight as well as lower blood sugar. And these are injected once a week. And their names are that you might have heard are called liraglutide, Trulicity, or Ozempic. There are drugs that can also stimulate the pancreas to make more insulin. These are older drugs called glyburide or diamicron. And there are drugs that can slow the absorption of sugar from the intestine after you eat. And the only one in this class is called glucobay or acarbose. But I do want to draw your attention. I've highlighted some of these drugs in red, such as these here, as well as metformin, because these drugs, there's some evidence that these drugs not only lower blood sugar, but may also decrease the chance of developing dementia or slow the progression of dementia if one already has it. And so these are exciting kind of developments because these drugs may actually be even more useful than just lowering blood sugar. How do we know that your blood sugar is well controlled? Of course, nowadays we can measure blood sugar by just pricking our finger and getting a drop of blood and measuring on a glucometer. So good blood sugar control is defined as having a blood sugar between 4 and 8 millimoles per liter before you eat, either before breakfast in the morning, but also before other meals. As I mentioned before, we usually measure blood sugar control by measuring the amount of sugar that's bound to hemoglobin and red blood cells, because this kind of measures blood sugar control over 3 to 4 months, and we aim for a level of less than 7%. But if for people are older, meaning more than 75 years of age, or if you have other diseases that makes you frail or makes one frail, or if we have dementia, then we usually aim for a higher target than 7%, more like 8%, mainly to avoid the risk of having low blood sugar. Because not only high blood sugar can increase your chance of developing dementia or making it progress more rapidly, but having low blood sugar is also not good and can similarly increase the risk of cognitive impairment. Nowadays, particularly if you're on multiple doses of insulin, patients can wear a sensor on their arm, which reads the blood sugar every 5 minutes and can store it in a receiver, or can be stored in a cell phone, a smartphone, which can be linked to the sensor. So finally, I'm just going to close by saying that diabetes and dementia are both global epidemics, and so definitely need to be tackled. The main concern of these two epidemics occurring together is that diabetes can increase the risk of dementia significantly. So we need to take steps both individually and as well as a society at a government level to take measures to prevent diabetes. And this can be done by encouraging the population to achieve a healthy body weight right from youth, as well as through healthy eating and maintaining good exercise. And so we can do that as individuals, but government can also help us too by perhaps making sure that healthy foods are available, as well as that our environment is conducive to doing exercise. So, for example, making sure that our neighborhoods have sidewalks, because in many suburbs, people, suburbs that were developed 40, 50 years ago, many of them don't have sidewalks, and so people have to drive their cars everywhere. If you do have diabetes, there are still many things that we can do to prevent dementia or slow its progression. And these involve controlling blood sugar, blood pressure, not smoking, as well as healthy eating and maintaining good body weight. And I think what's exciting from a research perspective is that some of these drugs that we use for treating diabetes may actually be able to prevent or slow the progression of dementia in people without diabetes. And so, as we all know, we are urgently in need of effective medications. And so this is kind of an exciting area that is being actively worked on. So, so I think I'll stop there and